If you're a healthcare provider, such as a medical or osteopathic doctor, a chiropractor, a naturopath, an acupuncturist, or a nutritionist or a health coach, integrating functional medicine into your practice can help transform your patient's health and position you as an expert. Now, in this short video, I'm going to show you how to integrate functional medicine into your practice, regardless of the field of medicine that you have been practicing in. So just a little bit about me. My name is Tal Cohen, and I'm a functional medicine trainer. I'm also the author of the book, Treating Pain and Inflammation with Functional Medicine. And I've been in the functional medicine field for several years. I got my master's degree in functional medicine, and this is something I'm very, very passionate about. I've also established an integrated clinic in which we trained a variety of providers how to do functional medicine, and I'm a part of a group of teachers and presenters that teach functional medicine. So just a little bit about what is actually functional medicine, if this is the first time you encounter the term functional medicine. Functional medicine offers a unique approach to medicine, to finding and focusing on addressing the triggers of chronic condition, right? We use in what we call functional labs, functional tests. Sometimes we also have developed a functional medicine survey that helps you as a provider to find and identify where is that, so what is flaring up that inflammation, or what is feeding that disease pathway, right? So in order to find that biochemical imbalance or the trigger, we use tools such as functional labs. The bottom line is that in functional medicine, the approach, we actually focus on helping your patients to regain their health instead of focusing on managing their symptoms or condition. So very similar to the traditional medicine, with the concept of when the patient is healthier, their symptoms or chronic conditions will slowly reduce. And we have even seen patients start to reverse some of their chronic conditions when they change their lifestyle, diet, and other factors in their life. And so functional medicine is one of the core beliefs in functional medicine is that chronic inflammation is at the root of many of those health conditions. Now, we also have studies that are now showing us that diabetes type 2, pulmonary diseases, cardiovascular diseases, autoimmune, neurological disorders, neurodegenerative conditions such as Alzheimer's, arthritis, and even cancer has inflammatory component to it. And so in the mainstream approach, we could continue to try and suppress symptoms, manage the condition or the inflammation. But the real question we ask ourselves as functional medicine practitioner is what is actually driving that inflammation, right? Because if you can figure out what is actually driving that inflammation, you can actually address the root cause of their condition, and by eliminating or at least addressing it to the best way possible, you can help your patients to feel better, start regaining some of their health back, and reduce their symptoms, and maybe even help them not just manage their condition better, but also starting to reverse and heal their body, right? And so it's a very evidence-based practice approach to those chronic and inflammatory conditions. Now, as a functional medicine practitioner, you also are aware of, you're educated on, and you can use tools such as nutritional or herbal medicine, stress management, nutraceuticals, which are supplements that have a physiological benefit beyond the nutritional value that is found in food, to help patients to recover and to regain their health, right? Now, very often, these are safer alternative to drugs or surgery, and patients can use those over the long term without or with minimum side effects, right? So there's many benefits of why, as a provider, you would want to at least be educated and know what other alternatives or tools, right, you can use to help your patients. And so what is the best way you can integrate that functional or integrative approach into your practice? And when I coach providers, and it doesn't matter if it's a nurse practitioner, if it's a chiropractor or a medical provider, medical doctor, they always ask me, like, I do primary care or I do a certain type of therapy, how do I switch my patients from whatever I'm doing with them right now into the functional approach? Well, you have to start by educating your patients about what's actually triggering that inflammation, right? And that's true. The same is true if you are a medical doctor and you prescribe medication, right? Those medication will clear some of that pain and inflammation, for example, with arthritis or joint pain, but they won't resolve the issue that have led to that development of that inflammation, right? And so, or if you're a chiropractor and you're doing adjustments, then you're heavily focused on the structural approach to help patients, which is great, but there's also the metabolic approach, that inflammation that is keep flaring up, right? So in functional medicine, integrative medicine, and also regenerative medicine, they're still not a part of the mainstream approach. So many patients are not familiar with that concept. So the reason I'm telling you this is because it takes way more than telling patients that, are you interested in functional medicine to resolve your problems, right? Or are you interested in integrative medicine? Unfortunately, that doesn't tell them much, right? So there is a particular way to lead your patients, but for now, just remember that we want to open up their mind and open up the way they view medicine, and to understand that there are other ways that you can help them out, right? Beside a prescription of a drug or a therapy or an exercise or an adjustment or whatever it is that you're doing, right? When I was doing acupuncture, I would help patients with pain, right? We specialized in pain management. We helped a lot of patients, but unfortunately, that chronic flare-up and inflammation was still driving the disease, right? It was driving the progression of that joint pain, right? So patients were basically depending on me or the provider for the rest of their lives. So we want to educate patients about what they can do with functional medicine. So the first step is to get an understanding about their willingness to get better, right? And so the best script that I typically use is something like this. Joe, you have been suffering from joint pain and type 2 diabetes, for example, for 7 years. I can provide a prescription or other therapies depending on your scope of practice, but there is another way that might help you to reduce inflammation and pain, become healthier, and feel better. Are you interested in learning about it, right? So all you're asking is, you're basically letting Joe know, your patient, that there are other ways that can help Joe to start regaining some of their health back, or possibly reducing some of those symptoms, right? You're also asking for their permission, right? So we wouldn't want to solicit ideas or concepts to patients without asking for their permission. And when you ask their permission, they're going to be much more receptive to containing and thinking and processing your ideas, right? So we ask for your permission. Joe, would you be willing to, are you interested in hearing about this new form of therapy, this new approach to medicine that is now slowly gaining popularity? And it might help you with regaining some of your mobility, with reducing some of the swelling, it might help you with diabetes, whatever it is, right? So you ask for their permission. Now, Joe might tell you, I'm interested, doc, I've been suffering for so many years. I tried so many stuff out there. I'm really need some help. Like, what can you offer me, right? Or Joe might say, well, I'm not ready for that doc. Can you just give me the prescription? That is possible, right? So you might get one of those two options. If they're interested, offer them a first discovery appointment to get more information about their lifestyle, potential environmental exposure, maybe their diet, and how it's related to their condition, right? Now, why do I recommend it to be a separate appointment? Because, first of all, they need to know that they're coming especially for that occasion, for that appointment. It has to be something that would be separate, and I've seen providers that do it, that integrate it into their session, and that is possible. But my recommendation is, when you start, have your primary practice, or chiropractic, or naturopathic, or acupuncture, have it separate to make sure to allow time and allow that space to be focused on just their lifestyle, their diet, their environmental triggers, everything that we talk about in functional medicine, right? And then you can do it in any other way. You can give them offer them free 15 minutes introductory session. You can offer them to use their insurance. You can bill physician or non-physician nutritional consultation or a medical appointment. I've seen clinics that do it in different ways. You can offer them a discounted rate of $69 for that visit. And so these are just a few ideas on how you can start. You can start taking patients that you already have from whatever it is that you're doing, your practice, and slowly navigating them into a separate functional or integrative medicine session, right? Now, we have previously tried different, over the last 6 to 10 years, we've tried different models of prices. We tried anything from $287 to $150. We tried $95. We have ran $49 in the last few months. So it just depends on really where you are. If you're just starting, it could be $49, which is really affordable. It's affordable for most people, right? It's like the price of a couple's meal and dessert, right? It could be all the way to $150 or $300, depending on your own reputation, your experience, and how busy you are, right? And those, I typically recommend to have those meetings, schedule them as about 30 to 45 minutes, and sometimes even an hour if you need, to really dive deep into this patient's needs. If you're not sure about, if you're not so confident, I would typically recommend to schedule like a short 15 minutes, 10 minutes, sit with the patient, see about their willingness to actually change their diet and change their lifestyle. And if they say no, then just move to the next person. Don't waste your time and energy in somebody that is not interested in putting in and not committed to themselves to make that change, right? If they say yes, then great. Here you go, another potential client for your functional or integrative practice. In the end of the introduction session, after you sat with your client, you met with your client to talk about all potential factors that might increase their diabetes, their cardiovascular disease, maybe their joint pain. You want to make sure that you help them understand how whatever it is, like their diet, they eat maybe inflammatory food, a lot of sugar, fast food, maybe environmental exposure, maybe they're exposed to heavy metals, maybe they're exposed to mold in the house they lived in like 5 years ago, and that kind of aggravated their problems, right? Whatever it is, maybe they had a long period of time with high emotional stress, right? We know that can trigger an immune reaction, right? Or maybe they have harmful behavior. So after you kind of identify and took some notes, you want to make sure that they understand, Joe, it is possible that your arthritis or your joint pain was aggravated after living several years in a house that has mold, because we know that mold can trigger an immune reaction, right? Or because you've been living on fast food in the last 5 years, it is possible that actually triggers an inflammatory response in your body. And that causes you to have more swelling, more pain, more stiffness, right? And so once they're starting making those connections, now they are much more invested in having a conversation and in that therapy. The second thing is ask them if they are concerned that if this problem that they have right now, that they experience right now, will get worse in the future if not properly addressed. Now, why would we ask that? Because it helps them to understand what might happen to them if they will not properly address this problem now, today, right? One of the biggest issues that we see with patients with chronic conditions, and I've seen that over 16 years of working with clients and patients, is many of those chronic diseases are a manifestation of their own mindset. So many patients procrastinate and make wrong decisions when it comes to their diet, their lifestyle, their environment, right? And so we want to make sure that we eliminate procrastination, right? We don't want, the last thing we want is that patient to wake up 3 years from now, 5 years from now, right? And all those cardiovascular diseases will turn into a stroke or a heart disease or a cardiac arrest, right? I mean, we want to make sure that they're not going to have mild arthritis today and get to disability within 10 years, right? So we want to make sure that we ask them about it. And the best way to do it is asking, Joe, you talked about the joint pain and how you're not walking as much as you used to. Are you concerned that if this will not be addressed right now, are you concerned that the condition might aggravate, the condition might become worse? Are you concerned that 3 years from now you might end up in disability? Like, have you ever thought about that? If we're not going to properly address it today, right? So get them starting to think about how their future will look like. Yeah, right? That's really important. And then ask them, are you interested in, right, addressing those issues? And you basically asking them if they are committed to themselves to properly change whatever needs to be changed, right? Because you don't want to invest so much of your time and energy into somebody who will not invest time and energy into themselves, right? So these are the 3 most important factors that I want you to make sure that you do during your initial visit or consultation to make sure that this is the right client for you, right? It's got to be a good fit for you, and you also have to be a good fit for them, right? So help them understand how big this problem is. Help them make sure that they know what would be expected from them. Get their approval and permission to be on board. And then from there, you can start your path into focusing on addressing those issues. Finish your session with recommendations. That could be functional medicine labs. That could be filling up the functional medicine survey to identify what the issues are. That could be schedule the next session. That could be even a whole plan of treatment, right? And so whatever it is in a way that you decide that you're going to do it, then that would be the recommended way to do it. I'm Tal Cohen, and I'll see you in the next video.